Hi, my name is Matthew Neufeld. I'm an assistant professor in the Department of History at the University of Saskatchewan and the College of Arts and Sciences. And my interest is in early modern British history. That's what I teach. And what I'm doing now in my research project, which is called Care in the Community, the rise and fall of popular naval medicine in England between 1650 and 1750, is researching a particular moment in the history of naval medicine in the British Isles. What I'm doing is I'm looking at the period of time when the British Royal Navy moved from a system where essentially it operated what we today would call a P3, a public-private partnership. For about 100 years, the Navy, Royal Navy relied primarily on private individuals in coastal communities in mainly the south of England, places like Portsmouth and Plymouth, but also in places like in the county of Kent. So relied on private individuals in these places to provide the sort of basic health care for sick and injured sailors. It's important to remember that during this period of history, England was at war for at least Britain was at war for at least 5 times. And one of the biggest expenses that the Navy had to deal with during these wars was the cost of health care. It was very, very expensive to look after sick and injured sailors. And over the century that I'm going to be studying, I want to explore and explain why it is that a system that started out as a public-private partnership eventually shifted into a system where the Navy relied on hospitals that it ran and staffed itself. So why did it move from this public-private partnership where it relied on people who ran pubs, inns, and even people who just had space in their house, to look after sick and injured sailors? So that kind of system, a public-private partnership where the public is paying for private people to provide care, from that to a system where the Navy or the state pays for huge hospitals that it will run and staff itself to look after sick and injured sailors. So I think this research is interesting and important because it allows us to examine in a very discrete period of time and a very narrow range of variables, how governments cooperate well or not so well with private individuals in the delivery of a public good, in this case, the health of sick and injured sailors. It also allows us, because a lot of the care providers were women, it also gives us a sense of how important the healthcare industry, if you want to call it that, was for women, particularly widows, in communities like Portsmouth and Plymouth. So it allows us to talk about the early history of nursing and the relationship between nurses and the Navy during this time when healthcare was very expensive, when it was expanding, and it was increasingly recognized as something that was important for the Navy's success. So I guess I'm trying to add a dimension of healthcare to a well-known story, which is the story of Britain's rise to global preeminence, largely through the work of its Royal Navy, and how this story can also be re-understood through the lens of naval medicine, and particularly understanding naval medicine or naval healthcare as a public-private partnership.